Ladies and gentlemen, welcome back to another off the cuff episode. I'm not wearing my hat of intelligence, so I don't know how this episode is going to turn out. Just kidding. Stick around. It's a pretty good episode. I've got some really good news. Also bad news. I don't know how you're going to take it. There's an interesting article that just came out, and I want to share it with you. Uh, it's titled, "We Were Wrong. Transgender Clinic Founder Regrets Her Role in the Mutilation of Children." So the good news is that they admitted that they're wrong, something that I've been talking about for a long time. And the bad news is that they've been mutilating children. And this is the problem with this gender identity stuff, is that they're pushing kids from an early age before they can even make up their mind if they want a family. They're pushing them down this road to transition, to put them on drugs that sterilizes them. These puberty blockers block the puberty from happening, right? And this leaves a child sterile, of course, all the way up to hormone treatment so they can change genders, and then surgeries to alter their bodies in order to affirm their gender. This is all based on a lie that you can be born in the wrong body. This is what happens when you tell children that you're born in the wrong body, and then you give them no direction. They start looking for anything that will give them some stability, and then they push this kind of stuff as truth. And of course, I can't believe that as a society we have gotten to the point where we think that it's okay to do this to children. Of course, this trans movement goes far beyond the reaches of the school. I've talked about how men are able now to invade the privacy of women. I have two daughters. I'm sure you guys might have wives, children, moms, anybody who's going out public, change rooms, washrooms, any of that stuff. You can have these men who just identify as women invade the privacy. I don't know how that makes you feel, but I'm not cool with that. And of course, men coming into women's sports, taking women's scholarships away. So how are they doing this? Obviously, this is all through the equity. And in order for a man to be equitable to a woman, aka have the same outcome, same privileges, as they like to refer to, all you gotta do is feel like a woman, and you're good to go. So let's have a look at this article over here and get some good news for a change from all the bad news. I mean, it's all bad news, but at least, hopefully, they're learning. So right off the top, the puberty blockers are not reversible as we thought, and they have longer term effects on the kids' growth and development, including making them sterile and quite a number of other things affecting their bone growth. A gender clinic founder and former professor at the University of Toronto recently said that she regrets helping children transition and acknowledges that most gender confused kids will grow out of their dysphoria by adulthood. Dr. Susan Bradley came out against the popular model of affirming children's transgender identities and putting them on puberty blockers, according to an interview published by the Daily Caller. She is the latest medical professional to confirm that transgender drugs and surgeries are dangerous, although she maintains the false idea that someone can switch genders. She created the Clark Institute of Psychiatric Child, Youth, and Family Gender Identity Clinic and led the University of Toronto's Division of Child Psychiatry. Bradley, who is now in her early 80s, expresses regret that the clinic had participated in the administration of puberty blockers for gender dysphoria, which she now believes can cement a child's sense of confusion out of which they would likely otherwise grow, said Daily Caller reported. She also expressed concern about the drug's side effects. "We were wrong," Bradley said. "The puberty blockers are not as reversible as we always thought, and they have longer-term effects on the kids' growth and development, including making them sterile and quite a number of things affecting their bone growth. We thought that it was relatively safe, and the endocrinologist said that they're reversible and that we didn't have to worry about it," she further told the Daily Caller. "I had the skepticism in the back of my mind all the time that maybe we were actually colluding and not helping them. And I think that's proven correct in all Once these kids get started at any age on puberty blockers, nearly all of them continue to want to go on cross-sex hormones. This is pretty crazy that this stuff was allowed to happen. I'm going to link this article in the description below so you can have a read and make up your own mind what you think about this. I don't know if you know this, but the school works with a lot of organizations, and one of them is Rainbow Health and OK2Be Me, and all of these organizations are kind of intertwined. And OK2Be Me, for example, even comes into the school and talks to kids about their sexuality. So I have this manual. I have it printed out. I have a lot of these things. It's printed out over here. So it says Guidelines for Gender Affirming Primary Care with Trans and Non-Binary Patients. So in this manual, there is a bunch of information that talks about the medication that is used, the side effects, the cost of all these things. And I know that this lady that founded the clinic thinks that she is wrong now, but all of this information is out there as well. The problem is we're all looking at the same information, except that it's interpreted differently. So when I see these guidelines for affirming these children with who are having gender dysphoria or confusion, when I look at this, I'm thinking like, oh my God, what are we doing to these children? What kind of medications are we putting them? The risks and the side effects, these are lifelong consequences, and the infections that can happen during the surgeries and loss of sensation and all that stuff. So we're all looking at the same information, but the other side looks at it and says like, wow, this is so great. It's so nice that we all have the policies, and it's nice to know what medication to take. So from their perspective, they think that this is a great thing. You know, it's like reading a book on World War and seeing what Hitler did, and one side is like, wow, this is so bad. I can't believe all the things that he did. And the other one's like, well, look at this. It's like all of these ideas are very good. Maybe we should try implementing them, right? We're all looking at the same thing, except one person thinks that it's good and one person thinks that it's bad. I can't believe we're doing this to kids, honestly. And this is why I started this podcast, because this stuff needs to stop. And this stuff is rampant in our schools. It's absolutely crazy that we are putting these kids in situations and confusing them. All the schools, all the boards, they know about this. The teachers are not allowed to talk about it publicly, or else they get thrown out. Look at Carolyn Berjowski when she opened her mouth about the books in the school system. She got shut down. And what books did she talk about before she got shut down? One of them was about minors talking and discussing their sexuality in these clubs in the school, and the other one was about a kid transitioning on medical with medication, right? And just trivializing these procedures. And it's just so crazy that we've reached this point. And there's a lot of books in the school system that just have this gender spectrum, gender bending nonsense. And it all starts with the lie that you can be born in a different body. I don't see how this is empowering to kids at all. And if you want to accept yourself, just accept yourself a boy or a girl. You can be more feminine boy, you could be more masculine girls. It doesn't matter. It's like these people haven't even stepped out of their house and they've never talked to any people. And as soon as like, oh, my girl likes to play with cars, she must be a boy. Let's transition her. It's just craziness. It's crazy to see that there's parents who buy into this stuff. And the other thing about it is they sell this stuff, they sell these procedures as life-saving. And what happens if you don't want to participate in these life-saving procedures, or you don't accept them? Well, you are killing people, right? So because they're using language like life-saving, they're really appealing to people's compassion and empathy, and they're turning people against each other who say, I don't think this is a good idea. And it's like, well, would you rather have a trans child, or would you rather have a dead child, right? And the government of Ontario is giving $75,000 starting July 1st of this year for people to transition, which is a crazy amount of money. This stuff is all federally funded. It comes right from the top and it's getting pushed right to your kids. And I'm speaking out against it. I highly encourage all the parents tune in, and you got to pay attention to this stuff. Well, if you enjoyed this episode, I highly recommend that you check out my Women's Day episode where you will see Justin Trudeau saying that trans women are women, and Waterloo District School Board, of course, affirms this stuff, and they put out a statement to basically saying that men can be women. So I highly recommend as well. Check out my podcast with John Uhler. He is a therapist with over 12,000 hours of clinical contact, and he talks to the Hannibal Lecters of the world and people who were abused. It explores the mind of a deviant predator, and I highly recommend that you check it out. If you stuck around this far, I want to thank you, and until next time, take care.